Hello, everyone. I'm Dr. Marisa Weiss. Thank you all for joining us to talk about mental health and breast cancer. I mean, society has come a long way in bringing awareness to mental health issues, but this topic can still be difficult for some people to talk about, which is exactly why we're all here today. Whether you're feeling anxious, depressed, resentful, scared, defeated, depleted, frustrated, disappointed, lonely, or any other emotion, let's continue to move past the stigma and normalize this part of having cancer. I'm the Chief Medical Officer of Breastcancer.org and an oncologist, but I'm also a breast cancer survivor myself. And I know what it feels like to walk through the world while bearing those invisible scars of breast cancer. The emotional struggles can really sneak into everyday life, and it's exhausting at times, but there is hope. Today, we're going to talk about different options for getting help and feeling better. There is no perfect solution for everyone. Some things will work, others won't, and it can take time to see the benefits. But it's worth trying to figure out and try new ideas. Your quality of life is worth it. First, I want to thank our generous sponsor, Pfizer, for making our work on mental health possible, including today's event. We're fortunate to have a group of fantastic speakers whom you'll hear from shortly. Dr. Ting is the co-director of the Zakim Center for Integrative Therapies and Healthy Living at Dana-Farber Cancer Institute. She's a board-certified medical oncologist and medical acupuncturist and integrative medicine physician. She has led a number of clinical trials, research, studying acupuncture and yoga to improve cancer patients' quality of life and to address treatment and disease-related symptoms. For more than 25 years, Susan Glaser has been a senior clinical social worker at Memorial Sloan Kettering Cancer Center with special training in psychoanalytic, psychotherapy, sex therapy, and mindfulness practice. She works specifically with breast cancer patients and families to support them at every stage of treatment. Bethany Adair is a mindful coach, metastatic breast cancer thriver, and author of My Guru Cancer. She'll be sharing the mindset tools she practices and teaches for finding peace, joy, and gratitude in the midst of life's biggest challenges. Rhonda Schaller is an author, professor, and assistant vice president in the Division of Student Affairs at Pratt Institute. She co-leads the Mindfulness Collaboratory at Pratt. In addition to being an expert in mindfulness, Rhonda shares her wisdom and compassion as an active member of the Breastcancer.org community. We're thrilled for Rhonda to have her lead us in a meditation later in the program. And thank you all for being here. One aspect of dealing with mental health issues that lead to even more stress is that our family and friends simply may not understand, or we don't want to burden them with our emotions. This can happen at every phase of someone's experience with cancer. What people see on the outside can be drastically different from how we are all feeling on the inside. How many of you see yourself in one of these photos? And now, whether it's because we're trying to put on a happy face to protect our loved ones, or because they can't relate or can't understand, or we're saving our energy for something else, we often hide our struggles beneath the surface. This picture is from Instagram. It's created by an account called The Cancer Patient, which uses pop culture and humor to talk about the realities of cancer. Most of us can relate to this scenario where you, as the person with cancer, end up consoling your friends and families and about managing their emotions. I mean, you all know that relationship dynamics are an important piece of the mental health puzzle, and we'll be talking about that more in a bit. Before we introduce our speakers, I wanted to share what you answered before we asked what has been the most beneficial for your own mental health. And more than 900 of you gave your responses, and here are the results. keep in mind, these people were able to pick more than one answer. What they said was individual therapy or counseling got the most votes, followed by group support, then meditation and exercise. It was interesting to see that antidepressants or anti-anxiety medications came in just a little higher than cannabis. We'll hear more today about the research behind yoga and acupuncture. Hopefully, some of you will find one or more new things to try after this webinar and to find calm and feel better. Now I'm thrilled to introduce Dr. Ting Bao and Susan Glaser. And I'd like to thank all of you again for who submitted questions for this discussion. Susan, I want to start with a question we received asking what feelings are expected and normal after a breast cancer diagnosis, and what could indicate that someone needs urgent help for their mental health.
Well, there's no right or wrong way to feel after getting a diagnosis. That's first and foremost. Often people describe it like a roller coaster. So there may be moments of okayness, and then there could be any of the feelings you described or other ones. So emotions can change moment by moment, hour by hour. Someone can look at you cross-eyed and you have a bad rest of the day. You're in tears. I've heard people say they're on the subway doing nothing, looking down, and all of a sudden they start to cry. So it's very common to feel overwhelmed. That's one thing people feel often with a diagnosis. The information comes at you from all ends, appointments, making decisions. Usually that feeling lessens when you have a treatment plan and you have a focus. I've got to get through treatment. I've got to get on to the next cycle of treatment. Looking after your mental health is tantamount. It's very important. Stress and anxiety comes and goes. For some people, it doesn't go. But it's also very common if you talk to people in the waiting room or in a support group or look at some of the chats, everyone is feeling it. So do not be afraid to admit that you're feeling stressed and anxious.
Yeah, I mean, when you think about all the attention you pay to your physical health, all the
That's right.
interventions, the surgery and the
That's
radiation
right.
and the medicines and
You're so
everything else.
busy with all of that.
Yeah, and yet we don't have a chance to really address our mental health.
That's right.
Yeah, and it can be so overwhelming to know where to start with getting help.
That's
Doc-
right.
yeah, I was going to ask Dr. Bao, can you give us an overview of different types of mind-body therapies and how they are used in combination with conventional forms of treatment?
Sure, happy to. So thank you for having me here. So basically, mind-body therapies are a diverse range of practice that recognize the link between physical and psychological health. And all the study has shown is really offers significant benefit for patients and all of us. And so basically, it's typical fall into two categories. One is the practitioner-led practice, such as meditation, yoga, or Tai Chi. And later on, you can do them on your own. And also the other category is provider administered therapy, such as acupuncture and massage. So highly effective and minimum side effects. So basically can be readily integrated into conventional anti-cancer treatment, mainly to help reduce symptoms and also improve overall well-being.
Wow. And of course, all of these things are called practices. And one of the things
Yes.
that we all learn, the experts, I'm sure will, in their everyday practice, will say that what you practice gets stronger. So, and none of us are perfect, and we're all trying to learn how to, get through life with, better quality of life and hopefully longer life and all that. So these are all these new things you're introducing us to are things that we'll be practicing. Um, Dr. Bao, what does research tell us about practices like yoga, meditation, and acupuncture, and how exactly are they helpful? And how much time does someone need to spend in order to get the benefits?
Mm.
Sure, great question. So one by one, so yoga, you can basically, you can preferably start with a yoga instructor, then later on do it on your own. And then there has been lots of research on yoga for cancer patients. And the benefit really shows in a number of areas. One is sleep. There is a large randomized control trial, more than 400 patients randomized to yoga group versus usual care. And their sleep quality, duration, all these are so much better in yoga group. So yoga can be used to help sleep, help with pain. Like for breast cancer, aromatase inhibitor induced joint muscle pain. Like there's some study shows yoga can help with that. Anxiety, depression. So yoga has been shown to reduce anxiety and depression. And some study even shows reduce hot flashes. And in terms of how often, so most study were done basically usually is like 2 to 3 times per week, instructor led, and then daily on your own if possible. But don't let that, deter you. So basically a little bit is better than nothing. If like 2 times per week is fine. And then ultimately most studies like 8 to 12 weeks a session, and then you should be able to see the difference. In fact, most people can tell the difference. In
Yeah,
terms of
and it's also
meditation,
important.
yeah. Mhm.
Yeah, I was
Oh,
going
go
to say
ahead.
that when you do yoga and do these physical things, you want to ask the yoga instructor when you're working with them to, be mindful of the surgeries you've had or aches and pains you might have so that you don't stress
Yes,
out those parts. You don't want to get injured. You want to get stronger and not get injured. So you want them to develop some kind of personalized
Right.
approach to these new techniques. That's very useful.
exactly. So at the beginning, it may be good to have an instructor or like start with a group, but then gradually, usually you do that and then do self practice yoga. And meditation is amazing. Basically, it's a practice focus on like the awareness of the present moment. Forget about the past, forget about the future, just focus on present. So it's been like lots of research has been done in this area. And I would say most research has been done in something called mindfulness-based intervention. So it's basically usually once per week for 6 to 9 weeks intervention is class. It's about like 60 to 90 minutes class. And it's a group of up to like 20 people with the instructor. And the instructor would teach the attendees, participants, meditation, yoga, mindfulness, bring mindfulness into daily activity, etc., coping skills. And then after the session, like anxiety, depression, significant decrease to the point Society for Integrative Oncology and American of Society of Clinical Oncology put together a guideline recommending oncology professionals recommend patients with anxiety, depression to do mindfulness-based intervention. So yeah, and then also some study shows like mindfulness-based intervention help with sleep, decrease hot flashes, reduce pain. And then it's not the same as the daily meditation. So sometimes people don't really have the time to do MBSR, like a mindfulness-based intervention. So they can start with like daily meditation. And in that case, it's usually different study. You look at it at, I would say at least 7 minutes per day, preferably daily. And then you should be able to tell the difference, can help sleep. And lastly is I'm an acupuncturist. So there's lots of study has done on acupuncture. I would say the benefits is mainly primarily showed in pain. In my acupuncture clinic, it's like half of the patient came to me for pain, especially aromatase inhibitor induced joint muscle pain. Large trial basically shows it reduce the pain. And also chemo-induced nausea, vomiting. There's plenty of data shows that benefit. Hot flashes, also anxiety, depression, and fatigue. In terms of the frequency, I would say usually is like start with at least once per week for 4 to 6 weeks, and then you can space it out. I do acupuncture research. I know that not everyone responds to acupuncture. So if you try to like 4 to 6 weeks, it doesn't work. Maybe this is not for you. And then, there's plenty of other integrative oncology practice you can do. Yeah.
Yeah, and it's not right for you at the particular time with the symptoms that you have or the mindset. And, it's
True.
amazing to me, like your mind is your most powerful organ. And the
Yes.
same mind that produces all these really uncomfortable feelings. And by the way, I listed all those uncomfortable, difficult feelings, but you can also have it mixed in there, gratitude, love, hope, but they can be poisoned by or sort of polluted by these other negative feelings. But if you take the same mind and sort of like train it and harness it to apply it to things like meditation, like Dr. Bao is saying, and Susan will be sharing in a minute with us and our other speakers, then that's where the hope is that, that there's a lot we can learn. There's a lot of power that you have in your mind that you can train and redirect in other ways that are going to help you. Susan, for people who are interested in working with a therapist, is it important to find a therapist who has experience with specifically with people with breast cancer? And how do you know if someone is the right or wrong fit for you?
Great questions. I get asked that all the time. Finding the right therapist is a process, and it takes a dedicated effort, especially if you have never been in therapy before. So things to consider is, are they licensed? I personally don't think someone needs to have been a breast cancer or a cancer survivor to do the therapy for you. But I think there needs to be a connection to the person and an understanding. I've heard people say, I talked to my therapist, and when I told them I had breast cancer, they said, "Oh, you poor thing." That's probably not the type of therapist you want who's going to be emotional along with you. So you want to know about, do they take your health insurance if that's an issue? Will it cover, does my insurance cover the therapy? How are there limits to how many sessions I can take? Find out what their experience is, what training they have. Are they experienced in dealing with breast cancer, in cancer in general, or in serious illness? That might be fine. Find out about their fees. If you can't afford it, it's not going to work out. Are there charges for mixed sessions? Because sometimes being on treatment makes you unable to make appointments at the last minute. Where are they located? Do you have to travel far? Do they offer virtual sessions? Because that can be helpful if you're in treatment. What kind of therapy they're likely to provide for you. You can ask that without having to pay for it. You should ask them, what can they do for you? And remember that choosing a therapist is very personal. Cousin Charlotte loves her therapist. Doesn't mean that you have to go to the same therapist. Or you do go, but doesn't mean you have to like that person or want to work with them. So there's no one good therapist that fits all,
Right, for sure. And of
Very
course, you want them to be available when you're available. Like if you're a
true.
working person having a job and kids and the laundry and everything else, like you want to find someone who can, meet up with you for a session when
That's right.
you're available.
That's right. That's
Yeah,
right. And
yeah,
there are people like that.
yeah,
You just may have to look for them.
right. And as a follow-up, what do you think about the therapy apps, like the apps on
Well,
your phone? What do you think
I
about that?
think that's also a great question. Very hot topic. You have to be really careful about the apps because a lot of the creators, excuse me, do not have clinical training. They have technical training. So before you download an app that you feel connected to, make sure it's vetted by like an appropriate source. I know the American Psychiatric Association has an app of advisor, and I would suggest going on some big website to find out what they say about that app. Think about the information you give these apps. You want to be really careful about sharing personal information without knowing much about the app. There are good apps for relaxation and meditation. very good apps, and those you can just Google good apps and you'll find a list of them. There's also there are great search apps for therapists and for therapist directories where you can filter out information about their location, do they take insurance, and so on and so forth. Something like Psychology Today, Alma, Zen Care, and Good Therapy are reputable sources to help you find a therapist. But I would be very careful about some of these mobile apps that say, like we can cure anxiety. I'd be very, if it sounds too good to be true, it usually is too good to be true.
Right. And when you're feeling down and out, you're vulnerable. And
That's right.
when you need something and something shows up and says it's going to help you,
Right.
you get, you're seduced by it. You're
That's right.
persuaded by it. And you got to be careful because as you mentioned, like your privacy is really important. And, one reason why these scars are invisible is because we do conceal them. Like we are very selective in whom we share
That's
our
right.
anguish with. Uh, One of the things that really is can be an everyday, every night reality, Susan, I was going to say is, this is your work every day, is the fear of recurrence or the fear of progression for people who are living with metastatic disease. This fear can be paralyzing. It can intrude and pollute. Do you have any tips for living in the present and feeling positive about the future when this fear of anxiety takes hold? Let's say it's Breast Cancer Awareness Month, and every single channel, everywhere, you're hearing stories about the worst case scenarios, or your biggest fear is everywhere.
That's right. We call this actually every mole a melanoma.
What was that?
We call it every mole a melanoma. That
Oh, every mole melanoma.
when
Right.
you're diagnosed with cancer, all of a sudden your headache feels, oh my gosh, it could be a brain tumor. So this is so common. It is a universal concern. And it is very important for you to find a forum for you to feel normalized and to be able to talk about this. The other thing that would be really helpful is to find yourself a healthcare team that can take your calls and your portal messages and help allay your fears, and then connect you to a support that's right for you. That's how you get into the here and now. The thing I always say is your head and your feet need to be in the same place. Very often, my feet are on the floor, I'm at work, but I'm thinking about home, or I'm thinking about 6 months from now. Really, what you want to do is try to alert the friends and loved ones around you when they see you get foggy in your head. They need to say, come back to the present time. Let's think about today. Let's think about dinner. Let's not think about 6 months from now. That's a practice.
Yes, yes, it is. And I don't know what it is about human nature, but once anyone finds out that you've been diagnosed with breast cancer, people you hardly know have to share a terrible story with you.
Terrible story.
And I tell my patients, I say, whenever you see the story about to come down like a freight train at you, just put your hand up like this and say, thank you so much for caring, but I cannot hear another story right now.
That's right.
And because it's just usually a huge burden and it triggers your fear of recurrence. And it's really about their own need to unload their discomfort on you, back to the meme that we saw on the slide deck. But generally speaking, that's just good to know, that just be prepared that people are gonna come at you with all kinds
and feel entitled to say stop. If this doesn't have a happy ending, I can't hear it.
Right. I mean, I remember when I was diagnosed, I got chased down by a surgeon I work with who needed to leave messages everywhere telling me about some horrible scenario. Someone who had a diagnosis like mine, and then it came back and was everywhere, and she's got young kids and she's about to die. Like that's really what literally left those messages for me. And I still to this day don't really understand why all this happens. I know it's their discomfort that they're trying to deal with. Um, but in any case, it's a minefield, as you all know. Now, when you get diagnosed, you're wondering what the hell happened, how this happened to me, and what did I do right or what did I do wrong, and what can I change to reduce my risk of having another problem. I was going to ask Dr. Bao, what about the fear of cancer causing chemicals causing us distress after a diagnosis? And what about the patients that you see who are, let's say, extremely worried about every product they use, ingredients in all food, personal care products, clothing? They just want to do everything all at once to reduce their exposure, what goes in on and around them that could be unhealthy. How do you help people manage that sort of need and urge?
Great question. So I will approach this with empathy and also provide a balanced perspective. So I would usually start with, I understand. Acknowledge your worries are understandable. But then I'll move on to provide some context on this risk. So basically, explain the relationship between exposure and risk is very complicated and depends on many factors. Dosage matters. Lots of things like they say it cause cancer, the dosage is much higher than what you're exposed to. So in a way, not necessarily need to be too worried about that. And duration matters and individual sensitivity matters. And then, and also look at the scientific evidence. Those commonly feared chemical cause cancer, like some data are not like really strong. So don't think, the moment you be exposed to certain thing, you get cancer. And then, on the other hand, I always discuss with my patient is, in life, there's so many things you cannot control, and maybe focus on things you have more control over. For example, sleep well, that's really important. And then exercise more, all this, and eat well, and reduce stress. All of this will do so much more benefit compared to those little potentially risks of exposure. And
Yeah.
lastly, I would really try to explore, is this really your deep fear or is manifesting of your underlying anxiety? Because some people, I remember I was doing a consultation and the patient came in with 3 pages of supplements she was going to take. And I was, doing like herb drug interaction. And finally I put my foot like pen down. I was like, is this really you want to take it or is your anxiety wants to take it? And she finally, I was like, okay, fine, it's my anxiety. And then she was like, I'm so glad I basically said, let's just forget about this. Let's just focus on you. So yeah, so that approach, yeah.
Yeah. And as you say, you want to address the things that matter most. So, for
Yeah,
example, if you're someone who's having a lot of anxiety and your best friend are your cigarettes, it's the place you go to for comfort. You
exactly.
one-on-one time with this, this habit, this dependence you have on cigarettes. It's hard to give that up when it's your best friend. But that would be
Right,
a most important thing to work on, not on your own, but with help, because there are a lot of smoking cessation programs. Rather than do that, than throwing out every plastic thing you have in your house. Um,
right.
when people ask you what they can do, you can tell them, give them things to do that would make a difference. Like, for example, when I went through breast cancer, I remember going through the drawers and like going through and throwing everything out. My husband's like, whoa, 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 I just bought that saran wrap, what are you doing? And I'm like, no, it's going, it's going, it's going. And then I
Right,
know I replaced everything with like jars and glasses, and it was like no big deal. But you do have to get real with the things like, that people take for anxiety, like people are smoking, it's your source of comfort, or alcohol or other drugs that,
right.
try to, find healthier ways to manage, which has been a subject of this conversation all along. And I'm so grateful for all of our experts today. And I was going to ask Susan, just to talk about the relationships and how our relationships can be tested by a diagnosis. And one of our community members brought up ghosting and asked, how do I deal with my disappointment due to a lack of support and empathy from my loved ones?
I don't think I talk to a single person who doesn't have a story about how someone disappointed them on on some level, from ghosting to just some minor sort of infraction. Um, but I think it's really common and very important to be direct and honest and communicate to the people you love. Sometimes it's a way to weed out the good friends from the not good friends, but you'll see that certain really good friends just don't do illness well. I think it's, or loved ones don't do illness well. Cousin Charlotte hasn't been to chemotherapy with you. Be direct. You think she should know she went through her own cancer or she's a psychologist. People need to know what you need. Again, everyone's needs are not the same. So that meant a lot to you that she missed your chemotherapy appointment, then tell her. And it's okay, your needs change day by day. So one day you want her present, the next day you want to go to chemo alone because sometimes it's just easier to be alone. And talk to find people who get it. If that's a good friend, great. If it's your team, if it's the therapist that you're going to find. And again, really try to accept offers of help when people want to help and set boundaries. You get to decide what works best for you. If you like to go to sleep at 9 o'clock at night and your friend thinks, oh, it'll be fun, we'll have a girls' night watching old movies all night long, it's okay to say, I really appreciated this time together, but I try to go to bed at 9 o'clock. I need that 8 hours, 9 hours of sleep. So it's okay to set limits. So it's again a practice.
Yeah, and it's a part of that practice is even figuring out what you need, what you
Exactly.
want, what
So
you want to,
hard.
right, and what you want to hold on to yourself and what you want to let go for somebody else. I mean, like for example, grocery shopping. I need a few things from the grocery store. Someone asked you to, what can I pick up for you? That's a great thing to get help for. Pay them back from Venmo. You don't want to you don't want someone to come in and read your kid a bedtime story if that's the source of pleasure and meaning that you get each day. But you do need to do work and sort of figuring out, okay, what do I need? What do I not need? What can go? I always suggest to people, let the housekeeping go. Just take the vacuum cleaners out of your closet and put them outside and put the cleaning products on the back of the toilet. Everyone thinks that everything's clean just by seeing those things present. Don't even worry about doing the housework. Save your energy.
Great trick.
It's a trick. It works. I've used it, but yeah, no, knowing what to and knowing that your needs are going to change over time. Uh, and I had a really close friend who disappeared when I was diagnosed. Her family all reached out to me, I'm thinking about you. You okay? You got this, all this positive talk, right? And she did nothing. And then years later, she crawled back and said, "Can I please, please, be friends with you again? And like, is there anything you want to tell me?" And I'm like, "Yeah, well, guess what? I mean, if you were going to be friends, I do need to tell you that I was disappointed and hurt by you're not coming through, coming forward." And of course, that you never know what's going on in someone's life. I have no idea what was going on in her life at the time, but let me tell you, I did let her crawl back in, and we're friends again, and I get pleasure from that. So there's a time and a season for all these different things. And there's grief. Like when I lost her, I grieved that loss. And Susan, I was going to ask you about grief. Can you talk about anticipatory grief and other types of grief that a patient might feel at any time, including when treatment's over or when friends and family don't understand this kind of grief? And what advice you have to explain it to people?
So anticipatory grief is a natural response to a loss that you anticipate, that you are imagining. You get the diagnosis, you imagine what life is like without breasts, on chemotherapy. What will it be like not to have hair? Can I not, how long won't I be able to work for? Cancer is just a series of losses. We sadly call it the gift that keeps on giving, loss or taking for that matter.
Stealing,
What, yeah.
stealing
That's
joy,
right,
stealing
that's right,
comfort.
well said.
Yeah.
So recognize that your feelings are normal and try to talk about them. Give yourself grace to feel what you're feeling. Loss begins from like, hello, and continues even after treatment's over. How many people are finished with treatment, although they're on anti-estrogen therapy perhaps, or really finished, and people say, you look great, your hair is back, it's over, let's celebrate, and you don't feel like it. You're still mourning the breast loss, the crickety bones that you feel. You're still experiencing losses, and people want to celebrate, and you don't feel like celebrating. That's loss. That's usual. I hear that daily. People with metastatic disease are experiencing just this ongoing waves of losses. And, good news, then bad news, treatment's working, treatment's not working. I feel crappy. Now I feel okay. It's a series and it comes in waves. Seek support again through your team, through loved ones that get it. If not, then find people that get it.
Yeah, and you get so beat down and worn down thin, and most people don't have a break. You just go from one treatment to the next,
One,
to the next, to the next.
right.
So taking a break from it, stepping outside of that, the relentless demands of treatment, and just to get a break, get out of Dodge kind of thing, go
Yeah.
into nature, shift it up, it makes a big difference, I think. Dr. Bao, I'm going to switch over to like brain fog. And do you have any recommendations for managing this brain fog, like difficulty focusing and concentrating, and which all that can contribute to depression, feeling helpless?
Definitely, yeah. It can be contributing to depression, also can be a symptom of depression. So yeah, and also I think brain fog now, before we were looking at different symptoms separately, but now more and more so, we're looking at it as symptom cluster. So rarely is just one person only experience one symptom. Like brain fog, sometimes people also have insomnia. So it seems to be closely related to sleep. And also sometimes people may have fatigue, pain, anxiety, depression. So maybe change lifestyle to target all this area if possible, starting with sleep. So try to get 7 to 9 hours of quality sleep if possible. And yeah, that's important. And also exercise is really important. Try to exercise half an hour per day for 6 days per week. Make a big difference. That helps both with sleep and fatigue, and also the mental acuity. Mainly because when you're exercising aerobic exercise, you increase oxygen in your body and you can think better. Nutrition support. So we usually recommend Mediterranean diet, which is rich for omega-3, which potentially help with the brain function. And then acupuncture. So at MSK, when I was back there, Memorial Sloan Kettering Cancer Center, we did this sleep study. And then basically we found people who sleep better, their cognitive function is better. Using that, we applied for a grant. It's called the Enhanced trial. It's acupuncture versus fake acupuncture versus no acupuncture to help with brain fog. So the study results should be out pretty soon. Yeah, so try all
And
this and go ahead.
yeah, no, I was going to say, sleep is queen. And,
Yes.
it's really important to look online, breastcancer.org, about sleep hygiene. It's a strange term. but you kind of think of
Yes.
yourself as a newborn baby and put yourself to bed at the same time, wake up at the same time, try to eat at the same time, exercise at the same time. You're trying to bring back sort of the rhythms and rituals and routines that you have in your life so that you can sort of move forward and feel like, okay, we're moving forward. We're getting there. We're gonna get back to a better place. I was gonna ask a question for both of you. Susan first, or whichever first, whoever first. What are the pros and cons of taking antidepressants for someone who has a history of breast cancer?
Well, I can't speak to the physiology, the medical part, but the people I know that are taking antidepressants, and a lot of patients are, they find it very, very helpful. Often there's resistance at first because I'm taking a lot of medication. I don't want to take medication. But when you think about it, you might be feeling anxiety, tremendous anxiety, physical anxiety. It's affecting your sleep. It's affecting your appetite. Maybe you're depressed. It's affecting your appetite. It's affecting your sleep. Think about what that's doing to your health. And
Absolutely. And it's not just, it may be for right now, not forever. Dr. Bell, how do you counsel someone on this, the role of antidepressants?
I think if you need it, you need it. Like, yeah, so it help with mental health and potentially improve quality of life and reduce pain. Some antidepressant reduce hot flashes too, and can help people sleep better. So I wouldn't resist that, but I would follow up with the expert and then, get on the right dosage and all this. There are potentially some consideration as well. One is like a drug-drug interaction, because for patients, say on tamoxifen, if they're on certain antidepressants, they may reduce the effectiveness of tamoxifen. So just need to make
Right.
sure you know that.
Absolutely. Absolutely. And I
Yeah,
know we limited time left, but I was going to ask Dr. Bao,
sure.
I know how important it is the integrative medicine approach that you have. People love that, want that, need that. What's the most important
Yes.
aspect of integrative medicine that you think people need to know? And how do they get access to it? And are there sort of like free or low cost ways to try it?
Yeah. So I think for me, the most important thing to get out is make it complementary, not alternative. So don't just, stay with the conventional, with the standard anti-cancer treatment and use all these integrated medicine approaches on the side to help support you. It's not like it's work together better. And then
Yeah,
also evidence matters. There are so many different approaches as good evidence, which is mentioned. So try to use those approaches. In terms of those free low cost like resources, it's plenty of them. YouTube, yeah, you can just Google like yoga, Tai Chi, and other things, and different apps, right? Insight Timer, Calm, and other things. And then so yeah, so there are plenty of resources, and MSK has this About Herbs website. It's totally free, and it give you all this information about dietary supplements. I think I use it often, recommend it all the
wow,
time.
that's
Yeah,
great.
and
That's
yeah,
great. Also, back to the environmental, the choice of personal products, the EWG Environmental Working Group has a website database called Skin Deep, which is useful. And Susan, we have one last question. I know we don't know very little time left, but important question, which is, for someone who has trouble asking for help, how do you suggest that they sort of get beyond that resistance and just ask, invite help?
great question. Really tough when you're so self-sufficient and you feel that it shows a weakness. Work on that self-talk, that asking for help is quite the opposite. Um, if you're not doing this, you're not going to be able to do things if you're not asking for help. So it helps you to acknowledge that you have current limitations, either resources or physical abilities, and ask for help. People are more than happy. Find
Right. They
people that
may be waiting for an opportunity to help you. They just don't know how,
exactly.
let them in. Well, I want to thank you both so much for sharing your insights, for all that you do every day to help people dealing with breast cancer. We are so, so grateful. Thank you.
Thank you.
Thank you.
Thanks.
Now it's my pleasure to welcome Bethany Adair. Bethany, as a mindset coach, you teach a mindfulness practice that also helps you as someone living with cancer yourself. Can you walk us through it and explain how someone would apply this technique if they're feeling anxious about whatever, their diagnosis, their scans, medical appointments, revealing their work-related stuff? Tell us how your work as a mindset coach addresses this.
Absolutely. And thank you so much for the invitation to be here. And gosh, everything shared so far, I'm taking notes. If I were on video, I was doing this the whole time because so many of these tools are actually things that I do integrate in my own healing journey as well. And I will say they work. And yeah, so a little bit of my background is I was diagnosed with stage 2 breast cancer in 2015 and then stage 4 in 2021. I am a mindset coach and also the author of this sweet book, baby, My Guru Cancer. And ironically, I got certified in this practice 2 months before my first diagnosis. I was working with in wellness as a yoga therapist and had all these plans on how I thought I'd share this work. But instead, that diagnosis turned out to be the biggest invitation to practice what I preach. And
Wow.
so, I call it a mindfulness practice because we get to take a look at what our mind is full of in those moments of anxiety, fear, hopelessness. Like, what are the stories, the thoughts running through our minds in those moments? And it's quite common that the beliefs that are running in our head, or I like to call them BS, belief systems, are actually not what's happening right here, right now in your real life. They very much, your mind will jump to the past or the future. And so this technique is a way to meet those thoughts, with compassion, with kindness. And it's really simple process. It's just 4 questions and some turnarounds. And so I'll actually share a little taste of the practice around anxiety, because my goodness, it got its own term. That's how popular and common and universal this experience is any type of fear and anxiety, not just around scan time, but also around any appointments, or you see, a message in your My Chart, you're on Instagram and you see a story of what happened with a friend or, someone else traveling the cancer journey. So the mind is, there's no shortage of stressful thoughts and situations in this cancer journey. And so I actually have my scans coming up in 2 days. On Thursday, I'll have my next round of scans. And so I'm always taking a look at my mind and emotions and what's happening. So a really common thought that obviously comes up during that time is the doctor will give me bad news. There's some kind of bad scenario coming up. Either cancer will come back, or it will progress in some way, or there'll be something questionable on the scan, and that fear arises. And so I'll just walk myself through those questions, and just please know you don't have to write these questions down. There are going to be some resources for you to practice this work on your own. But the first question is it true? Just asking myself, is it true? As a meditation, the doctor will give me bad news. And I just want to give myself an honest yes or no. And when I'm freaking out, yeah, the answer is yes. It's like, I know it's coming. It's happened before. It could happen again. I had that ache and pain or a headache, this week. Oh my gosh, yes, it's true. And then I move to the second question. Well, can I absolutely know for sure that it's true? Can I know 100% without a doubt that the doctor will give me bad news? And it's just a yes or a no. And that question gives me pause. I really get to check in and look, God, can I know 100%? Do I have evidence that would hold up in court for that? And I often find a no in this space, but no matter what your answer is, you can still move to the third question. And the third question is all about honoring all the thoughts and emotions that do arise when we're believing these thoughts. So how do you react? What happens when you're believing the thought that the doctor will give me bad news? Well, immediately in my body, it's like my breath goes away. I feel tension in my shoulders. I am panicking, anxious. I see images of the doctor giving me bad news, and then I have this whole future of what that will mean. Now I have a new treatment plan. What if I run out of treatment options? I'll have side effects. I won't be able to live a full life. There's a whole world happening when I believe that thought in my mind. And so I like to sit in that question for a bit, just to empty, to get those emotions, get those scary thoughts out of my mind, out of my body. And once I feel empty, I move to question 4, which is, who would I be without the thought? So I'm not changing my body. I'm not changing the fact that I'm having scans coming up, but who am I without the thought? And that can bring me back to the present moment. I look around and see my body's breathing. I can move. I feel really healthy and strong in this moment. I'm able to see how scans are really supportive. They let us know what's going on in our bodies, things that I can't see or touch, so which can guide us to a better path of healing. So I feel more confident and encouraged. I'm making the right choice going into scans. I see my doctors as support. I can reach out to people. I take care of myself in that space. So I'm not so preoccupied with the what ifs, and very much more dropped into what we talked about earlier, the present moment. And then the last part of that process is called the turnaround. So you take the thought and kind of flip it around to different opposites and see if that could also be true. So the doctor will give me bad news. The doctor will give me good news. I try that on, and I don't want to look at it as just a positive affirmation. I actually want to find examples or proof of how that could be true, that the doctor will give me good news. Well, that's happened before. In fact, I've had scans with more good news than bad news. So I like to remember that about the past. The doctor could give me good news. I do have some guidance that my treatment right now seems to be doing really well. My tumor markers are dropping, so I use that as evidence. Also, they could give me good news even if those scans do show some kind of growth, progression. I can also see how that could be good news, because I'm not interested in being on a treatment plan that isn't working on the cancer. So I want to hop on something as soon as possible that can meet the cancer where it is and address it. So it's always heartbreaking news to have that information of progression, but it also can lead to a better healing path for you. And then I look at the turnaround, like, I'll give myself bad news. And that's the funny part about this, is I'm already doing that in my mind. I'm already seeing, this worst case scenario of the future. And that is complete imagination in this moment. So that's a little run through of the process that supports me most. And it can be used in any challenge in cancer.
Absolutely. And every time you keep circling around with it, you get haunted with these thoughts, it keeps festering, and it's good to shift it, mix it up, and derail that, because
Yes.
you'll keep thinking if you don't do that. And it's good to have a plan for getting results from your doctor. So because the uncertainty is what can often make things worse. So having a plan, like, I'm getting my tests on a Tuesday, can I get the results from you on Thursday, or as an example, and what time can I call you, or will you be around? Can I email you, go through my portal, whatever it is, make a plan for that.
Yeah.
As you said, no matter what you find on these exams, the test results, usually there's something that you can do about it. And so it's just a question of what is it that you need to do about it. Now, I was going to ask you, what would you say to anyone feeling guilt or shame about having cancer, or the emotions they're experiencing because of cancer? I mean, there are people from cultures where they're made to feel like getting cancer was their fault. How do you handle that?
It's so common of an experience, and it's something I've dealt with myself. And I even had a really healthy background. I ate organic. I have no family history of breast cancer. I was doing, lots of things to take care of myself, and still got cancer. Yet I still turned on myself. And so you caught that belief, cancer is my fault. There's other beliefs like I could have done something to prevent this. Or, if only I were more evolved or spiritual, then I wouldn't have gotten cancer. Or if XYZ happened, I wouldn't be in this scenario. And First of all, like I walk myself through that process that we just did. I question those thoughts, but there is one question that I ask myself that kind of stops me in my tracks. And can I prove it? Can I prove it without a doubt 100% that if I could have done XYZ, cancer wouldn't have happened? And I personally can't find that proof in my life. All I know is that it creates more pain, more suffering, and cancer is difficult enough. That shame game and self-blame makes it so much harder. So if I could give people one advice, and I tell myself this too, it is not your fault. And there are so many ways we're empowered in this journey. You've talked about, loads of them in just this call. And we get to face this journey any way we want. And, for me, I like to focus on a lot of gratitude, a lot of joy. I renamed my diagnosis as Live the F Out of Life because that sounds a lot more fun than stage 4 cancer. It makes me laugh and smile, but you get to do it any way you want. And whatever emotion you're feeling, whatever belief is running through your mind, you're absolutely not alone in that.
Yeah, I mean, and it's also true that our diagnosis makes other people uncomfortable and they want to better understand
Yeah.
how it happened to you. So they try to figure out what to blame it on, like some
I
kind of.
know.
I remember my mother asked me when I was diagnosed, she goes, "Did you catch breast cancer from your patients?" Because I was I was diagnosed 15 years ago and I've been practicing for 30 years. And she really, it was an innocent question, but she was just searching for something to blame it on. Well,
Yeah.
Bethany, thank you so much for talking with us today and sharing your positive energy and perspective. And we are really looking forward to having Bethany lead a workshop for one of our metastatic breast cancer support groups. And we'll send the registration link to you all in an email for yourself or someone else that you care about.
Yep, that'll be next month.
Great,
Very
great.
excited.
Thank
Thank you
you.
for
Thank
having
you
me.
so much.
Mhm.
Now it's my pleasure to introduce Rhonda Schaller, who teaches with the Integrative Medicine and Body program at Pratt Institute. Rhonda will lead us in a short meditation that addresses many of the feelings we've talked about today. Rhonda is also a beloved member of the Breastcancer.org community, who's living with stage 4 breast cancer. Rhonda, I would like you to take it from here and lead us, please. Thank you.
Yeah, my pleasure. So let's take a moment, and we've heard a lot of wonderful advice and some fabulous ways forward through our emotions, our thinking, our sensations. And so we're going to take 10 minutes and let it go. Let the mind begin to settle. And I'm going to lead you, I'm going to guide you in a meditation so you can really begin to come into the present moment as best as you can. So here's our invitation. Eyes can be open or closed, to your choice. Feeling your feet firmly on the ground. Wherever your hands are, they're resting in your lap or by your sides. And just checking in with the body. Perhaps you need to stand because you've been sitting and it's uncomfortable, or you need to lay down or sit. Just take a few minutes and adjust your body. And then as you're ready, relaxing into the body. And so let's begin. On purpose and with intention, let's let go of what we've been listening to, what we've been doing, and just bring your attention into the present moment as you breathe. And so to do this, it may help to bring the focus of your attention just to your breath, wherever the breath is in this moment. Just notice, are you breathing short in the body? Is it at the chest? Is it deep in the body? Is it in the belly? Is it just at your nostrils? Wherever your breath is, just allow yourself to notice that you are breathing. And you're breathing in and you're breathing out. You're breathing naturally. Just letting whatever rhythm for you is comfortable. And if your mind should wander into yesterday or tomorrow, it is perfectly fine. Just notice a wandering mind. It's natural. But escort the mind back as soon as you notice you've wandered, back to your breath. So we are breathing together, breathing in and breathing out. And you might notice as you breathe in and out, just very slowly, this feeling of relaxing a little bit more with each out breath. Focusing on your breath a little bit more deeply, letting go, letting be. So you're breathing in, you're breathing out. Each time you wander to thinking or listening to sounds or sensations, just with kindness notice, and then come back. Feet are on the ground, hands are in the lap. Perhaps you're just noticing how your body is as you release and relax into the breath. And perhaps the breath deepens and quiets all on its own as we're breathing. As my voice guides you, you're breathing in, feeling it deeply, completely. That's our invitation. Feeling the breath move through the body as we settle the mind into noticing this focusing, this natural feeling of breathing in and breathing out, just going with it. Calm and relaxed as best as you can in this moment. Calm and relaxed, effortlessly breathing, one breath at a time, no two breaths the same. Allowing your breath to take whatever rhythm feels comfortable for you in this moment. As we relax and release and let go into the breath. And the breath might become longer and finer, perhaps. You notice a pause in between the in-breath and the out-breath. So you are simply allowing your breath to come in as its own accord, effortlessly, and out on its own accord. And if the mind wanders away, with kindness, just notice, and then come home to the body and the breath. Noticing each breath in and each breath out, and just feeling the ease of it all. Just allowing yourself this quiet, centered stillness. Holding your attention lightly on the breath. And you might notice sounds coming into your awareness. It's perfectly fine. The sound of my voice. It will come and go. Sounds in the room, outside your window. Notice if sounds occur. And they will come and go as they're ready, like white clouds drifting across the blue sky of your mind. Just let them come and go as you return to the breath. Allowing your attention to rest lightly on this stillness the breath can unfold within you. And you might notice sensations in your body as well. Just let them come and go just the same as sound. Without judgment, as best as you can, we simply notice within our awareness and return for another minute on the breath, letting things come and go, breathing. The ease of it all, as best as you can. Breathing in and breathing out, and just merging, dissolving, being in this moment. And then if your eyes have been closed, opening the eyes, perhaps wiggling your fingers and your toes, and just taking a moment, perhaps even putting your hand on your heart, a moment for gratitude that you allowed yourself these 10 minutes to breathe and to be, inviting the calm, abiding that is natural within you. So I thank you for your practice, and I'll turn it back to Dr. Weiss.
Wow. Wow. Rhonda, thank you so much again for leading us in that powerful meditation. And thank you for all you do to help others in this community. You are a godsend. You're like manna from heaven, right? Truly. Thank you. Before we go, I want to summarize some of the important information that was shared today, some of these take-home pearls. We'll also email you with articles, videos, and podcast episodes. There is a lot of great information that can help you during this challenge. So from reframing your thinking to learning coping skills, repairing relationships, building mindfulness, exercising, improving your sleep and overall quality of life, there are so many ways we can try to manage what we're feeling or give us a better quality of life in our everyday. When it comes to mental health support, many people think of one-on-one therapy with a counselor, but that experience can vary, as you've heard. Experts may follow a specific approach like behavioral therapy, cognitive therapy, and more. And group therapy can provide clarity, ideas to help you, and introduce meaningful relationships as long as the groups are carefully designed and created. Our team at Breastcancer.org, because of what you've shared over the years, we offer free virtual support groups, which take place every day of the week. You can sign up on Breastcancer.org. We will email all of you with a direct link, and we hope you'll join us. Other mental health support options could include antidepressant and anxiety medications, cannabis for pain, anxiety, or insomnia, sleep medicines, and we talked about sleep hygiene, and also possible other supplements that you may be hearing about, depending on your situation. There are complementary medicines and therapies like acupuncture, meditation, yoga, and lifestyle changes that can help relieve your symptoms over time. And again, these are practices. You can learn a little, try it out, learn a bit more, try it out, or just keep practicing what you learn. what you practice does grow stronger. You have to choose what you want to practice. If you want to practice feeling anxious, then you'll be anxious all the time. But if you practice some of the meditation tools that you've heard about today and other things, you'll get stronger at that, okay? You'll also find more information at breastcancer.org/mental-health. breastcancer.org/mental-health. And just remember, before you try something that could interfere with your breast cancer treatment, it's important to discuss that with your doctor. Like Dr. Bao said, there's some medicines that get in the way of tamoxifen doing its job, as an example. If you've decided to work with a therapist, but you don't know where to start, you could ask your medical team or hospital, your social worker or your navigator. Go to people you trust for referrals. You can use your insurance company's database or search on the psychologytoday.com website. They have a database that will show you at least people who are in your network and who are near you and all that. It can take time, and it will take time to find someone who's the right match for you. The person who's helpful to you now might be different from the person later on. Our needs change over time, right? Okay, well, the cost of therapy can be intimidating on top of everything else, all the other expenses that you've had to shell out to be treated for breast cancer and all the things that happen with it, right? All the parking and all the babysitting and extra food and whatever it is. So the first step is to contact your insurance provider to find out what's exactly covered. Ask your doctors if there's a fund in the hospital. Sometimes a donor will say, I want this money to go to people going through this to help them make their way through it and get to the other side of it. Check the rules around healthcare providers who are in and out of your network, and look into using a flexible spending account or health savings account to handle the fees. That way you can, do it with pre-tax dollars. Talk with your doctor or hospital about mental health services, as I was saying, that they offer. There may be a lot there that you just didn't know about. No one thought to offer it to you because you got so good at hiding the invisible scars, right? No one thought, oh, maybe you need a little help, right? You can also ask your therapist if they will charge on a sliding scale, meaning that the rate is adjusted based on your income. Well, I hope to see all of you again on June 17th for an Ask Me Anything webinar to answer your questions about breast reconstruction. And then on July 22nd, we'll be talking more about mental health solutions and hearing from patients and advocates who understand exactly what you're going through. They'll share their personal stories, and we'll learn from each other and from another leading mental health expert. Finally, I would just want to thank you. Thank you for joining us. Thank you for taking this step forward to help yourself. I hope today's webinar has given you some new ideas and information and validated what you're feeling. Thank you again for being here and for being part of the Breastcancer.org community. Thank you to our amazing experts. We hope you all take care of yourself and reach out and ask for help and accept the help, and do that homework of thinking about what would make me feel better. What do I need right now? What would make me feel joy, comfort, spontaneity, hopefulness, looking forward to the next day and feeling freer from the fears that can be so gripping. So thank you all for being here, and take care.